Now in the important structures of the neck, first after completion of the boundaries and contents of the triangles of the neck, then I have started with the important structures. Okay, so it is not possible to describe all the important structures, so few I have selected, and other things whatever it will be left, that you have to study from your own. Okay, something you have to do self study also, everything cannot be taught inside the classroom. Anyway, when I have segregated the important structures of the neck, at that time I have mentioned that great blood vessels are there, then there are some important muscles of the neck. Okay, in the muscles of the neck, we have discussed about the suprahyoid muscle, infrahyoid muscles, right? Then I have shown you the sternocleidomastoid muscle, origin, insertion, nerve supply, action. Okay, so like this, I am segregating and then I am describing almost all the structures. Now, in the blood vessels of the neck, first we have discussed about the veins, important veins. Okay, external jugular vein, internal jugular vein, anterior jugular vein, then jugular venous arch. Okay, now we are in the arteries. Now, in the arteries, first we have to see the common carotid artery, which we have discussed earlier. Okay, then from the bifurcation of the common carotid artery, we are getting two arteries, that is the internal and external carotid artery. Okay, now if you see the bifurcation of common carotid artery, it is taking place at the level of lamina of the thyroid cartilage, superior border of the lamina of the thyroid cartilage. Okay, so once it is bifurcating, we are getting internal carotid artery and external carotid artery. Okay, now what will be the course of the external carotid artery? So from the point of the bifurcation uh, to the mandible, okay, posterior aspect of the mandible, inside the or in the substance of the parotid gland, this external carotid artery, it bifurcates, or you can say terminates by giving two terminal branches. Okay, as you can see, so this is the common carotid artery. Okay, as you can see, this is the internal carotid artery. Now this is the point of bifurcation. From the point of bifurcation, it will ascend. Okay, and see the termination, it is giving two terminal branches, there is superficial temporal artery and the maxillary artery. Next, if you see the branches of the external carotid artery, very important, because external carotid artery is supplying the neck region, it is supplying the face, it is supplying the most of the scalp. Okay, even the deeper structure of the face is also supplied by the external carotid artery. Next, the branches of the external carotid artery, okay, is divided into different groups. For example, anterior branches are there, posterior branches, then medial branch, and then terminal branch. These are the various branches of the external carotid artery. So I hope you can see the diagram. So these are the anterior branches, these are the posterior branches, this is the medial branch, and these are the terminal branch. Like this, the divisions are there for the external carotid artery. Now, in the anterior branches, the arteries which are arising, as you can see, these are the fascial artery, lingual artery, and superior thyroid artery. So the first branch will be the superior thyroid artery, after that lingual artery, and then fascial artery. Fascial artery, already we have discussed the codes, branches, termination, everything we have discussed about the fascial artery. Any idea about the lingual artery? Lingual artery is supplying the tongue. It is the chief source of blood supply to the tongue. Okay. Next, superior thyroid artery. So the first branch is the superior thyroid artery. As the name suggests, it supplies the thyroid gland. Now for thyroid gland, another artery is that it is the inferior thyroid artery. Okay, which is the branch of subclavian artery. When you will study the thyroid gland, at that time you will come to know the superior inferior thyroid arteries, anastomosis is taking place and supplying the gland. Next, if you go to the posterior branches, okay, which are arising from the posterior aspect of the external carotid artery, only two posterior branches are there, as you can see, occipital artery and posterior auricular artery. So mainly these arteries where they will supply. Okay, for that I'll show you one diagram. Yeah. So with the help of this diagram, you can understand the area of the supply of external carotid artery. Can you see the posterior auricular artery and occipital artery in the diagram? Okay, so see, this is the occipital artery, this is the posterior auricular artery. The occipital artery is mainly supplying the scalp, posterior aspect of the scalp, posterior aspect of the head, posterior aspect of the neck, and the deeper muscles which are present on the posterior aspect of the neck. These are the structures supplied by the occipital artery. A posterior auricular is mainly supplying the area posterior to the auricle, and along with that it is also supplying the parotid gland. Okay. Next, ascending pharyngeal artery is mainly supplying the pharynx. Along with that, it is also supplying the middle ear cavity. Okay, these are the parts supplied by the ascending pharyngeal artery. Lastly, if you see the terminal branches, it is the superficial temporal artery and the maxillary artery. Okay, so superficial temporal artery is supplying the temporal region. Now, maxillary artery is very important. Okay, now, because this maxillary artery is the largest branch of the external carotid artery, okay, and it is having a wide area of distribution. Now, if you see the maxillary artery, three parts are there. Okay, in maxillary artery, three parts are there. There is a muscle called pterygoid muscle, a lateral pterygoid muscle. So, lower head of the lateral pterygoid muscle divides the artery into three parts. First part, second part, third part, or also called as mandibular part. Okay, then pterygoid part and pterygopalatine part. So, like these three parts are there of the maxillary artery. Now, this maxillary artery, each and every part is having various branches. Now, these particular branches of the maxillary artery supplies a huge area. Now, what are the areas? Okay, now you can see some branches are coming from the first part, some branches coming from the second part, and some branches coming from the third part. So, as a whole, if you see, total 15 branches are there. Approximately 15 branches are there of the maxillary artery. Now, here you can see the distribution and the branches of the maxillary artery. Okay, so I am not telling you that you have to study about each and every branch of the maxillary artery, though we are in the external carotid artery. Okay, so starting from the course, branches, everything we have discussed. So just you have to know the area of the supply of the main branches of external carotid artery. Okay, and among them, as I said, the largest one is the maxillary artery. Okay, now here you can see the divisions of the maxillary artery. As I said, three divisions are there. Okay, first part, second part, third part, and all the parts they are having branches. Can you count how many branches are there? Total how many branches are there? 5 plus 4 plus 6, 15 branches. So as I said, 15 branches are there. Okay, now in exam also no one is going to ask you write all the branches of maxillary artery. Okay, not possible. Just you should have an idea, okay, that the maxillary artery is supplying this part, and maxillary artery is divided into three parts. Okay, by the lower head of the lateral pterygoid muscle. Now, why you have to study? Because when we will go further, as we will go into the pterygopalatine fossa, when we will study about the upper jaw, lower jaw, then about the middle ear cavity, external ear, okay, then lateral wall of the nose, nasal cavity, paranasal air sinuses, those structures you have to study. So, for those structures, from where the blood supply is coming, the blood supply is coming from the maxillary artery. That's why I am showing you the branches of the maxillary artery and area of distribution. Okay. Now, if you concentrate over here, from the first part, you can see these branches are arising: deep auricular, anterior tympanic, middle meningeal, accessory meningeal, and inferior alveolar. Now, these particular branches, which particular areas are supplied by these branches? The skin of the external acoustic meatus, tympanic membrane, inner surface of the tympanic membrane, okay, the meninges, then vein distribution of the extracranial to pterygoid, lower 8 mylohyoid muscle. Okay, so these are the areas which are supplied. Next, second part, mesenteric deep temporal pterygoid buccal. Okay, so this will supply various muscles, for example, masseter, temporalis, lateral head and medial head of the pterygoid muscle, okay, and skin of the cheek. Now, the muscles which are mentioned over here, these are the muscles of mastication. We'll discuss about the muscles of mastication also. Next, the third part, most of the branches are of the third part, posterior, superior alveolar, infraorbital, greater palatine, pharyngeal, okay, artery to pterygoid canal and sphenopalatine. Sphenopalatine is the terminal branch. Okay, so these are the arteries of the third part. Okay, so as a whole, if you see all the branches and the supply, so the maxillary artery is supplying the external air, middle ear cavity, okay. After that, upper jaw, lower jaw, okay. Then lateral wall of the nose, muscles of the mastication, okay. So like this, then paranasal air, sinuses. So these are the areas which are supplied by the branches of maxillary artery. Now, there are some specialized structures present within the common carotid artery. And what are these structures? These are carotid sinus and carotid body. Okay, carotid sinus and carotid body. So, what is this carotid sinus and what is this carotid body, and where they are present? So, I have shown you the common carotid artery, the origin of the common carotid artery, and then the bifurcation of the common carotid artery. Okay. Now, in the point of the bifurcation, two important structures are present. That is the carotid sinus and carotid body. Now, what is carotid sinus? It is a fusiform dilatation at the terminal end of the common carotid artery. Okay, so where the common carotid artery terminates, in that particular part, there is a fusiform dilatation, and that is called as carotid sinus. Now, what is the speciality of the dilatation? It is rich supply. It is having rich supply of glossopharyngeal nerve, vagus nerve, and sympathetic nerve. Okay. Now, this act as baroreceptor. This particular area act as baroreceptor. Okay. Now, what is the function of that? Baroreceptor also called as pressure receptor, and it regulates the blood pressure which are going towards the brain. Okay, so as you can see, the carotid sinus acts as a baroreceptor and regulates the blood pressure in the cerebral arteries. Okay, so from the blood which is going towards the cerebral arteries, the pressure in that is controlled by this carotid sinus, which acts as a baroreceptor. Okay, now this is richly innervated by glossopharyngeal nerve, vagus nerve, and sympathetic nerve. That is the carotid sinus, very important. Okay. Next, another structure is that is called carotid body. Now, what is this carotid body? It is a small oval structure situated behind the bifurcation. So, as I said, both the structures are situated near the bifurcation. One is at the terminal end of the bifurcation, another one is situated behind the bifurcation. Okay, and it is a oval structure, the carotid body. Now, if you see, it is reddish brown in color. Different types of cells are there, type 1, type 2 cells, that will be discussed in histology. Now, this is also having rich nerve supply from glossopharyngeal, vagus, and sympathetic nerve. Now, this carotid body act as chemoreceptor. Okay, previous one was acting as baroreceptor. Now, this one is acting as chemoreceptor. So, इसका function क्या होगा? What will be the function of this? Now, it acts as a chemoreceptor and monitors the changes of oxygen and carbon dioxide content in the blood. Now, suppose if there is increase in the carbon dioxide in the blood and if there is decrease in the oxygen, at that time what will happen? It will stimulate, causing increase in the blood pressure and the heart rate, so that more amount of oxygen can be supplied to the blood, because that blood is going to the brain. Okay. So, here you can see in this diagram, this is the carotid sinus which acts as a baroreceptor, and this is the carotid body which acts as a chemoreceptor. Okay. So, both these structures are very important because they monitor the pressure of blood which is going to the cerebral arteries and the constituent of the blood, whether adequate amount of oxygen is reaching to the cerebral arteries or not. Okay. And as you can see, they are richly innervated with the glossopharyngeal nerve, vagus nerve, and sympathetic nerves. Okay, that is the carotid sinus and carotid body. Very important. Applied aspect questions are asked from this particular area. Next is the carotid sheath. Okay, so already I have mentioned about the carotid sheath in the last week. So what exactly is this carotid sheath? So these are the paired structures situated on the either side of the neck. Okay. Now it encloses very important neurovascular structure present in the neck. Now what are the structures enclosed? Common carotid artery, internal jugular vein and vagus nerve. These are the three important structures enclosed inside the carotid sheath. Okay. So medially is the artery, laterally is the vein, and in between these two structures the vagus nerve is situated. Okay. Next, there are some other structures, but those are not situated inside the sheath. The structures are situated anteriorly and structures are situated posteriorly. Anteriorly, we are getting the Ansa Cervicalis, and if you see posteriorly, the sympathetic trunk or sympathetic chain is present. And along with that, accompanying cervical lymph nodes are also there. Now, the question is how the carotid sheath is formed. Now, I hope you have studied about the fascia of the neck. Okay, so three sets of fascia together they are forming the carotid sheath. Okay, it is formed by the contribution of the pretracheal, prevertebral, and investing layer of deep cervical fascia, and it is extending from the superior mediastinum to the base of the skull. Okay, that is the extent of the sheath, carotid sheath. Now, inside the carotid sheath, the common carotid artery bifurcates. Once it bifurcates, the external carotid artery comes out of the sheath, but the internal carotid artery remains inside the sheath, and along with that, the internal jugular vein is also present. Okay. Now, a important clinical significance is there. I know you have studied about that. This is a pathway for spread of infection. That means from the neck, the infection with the fascial covering can spread into the mediastinum. Okay. Now here you can see the diagram of the carotid sheath. Okay. So as I said, it is a fascial covering derived from pretracheal, prevertebral, and investing layer of deep cervical fascia, extending from the superior mediastinum to the base of the skull. Okay. Inside this, you can see the important structures: common carotid artery, which is situated medially. Laterally, we are getting the internal jugular vein, and in between these two structures, you can see the vagus nerve is situated. Now, common carotid artery bifurcates inside the sheath. Okay, and the external carotid artery comes out. You can see the external carotid artery is coming out, but internal carotid artery is remaining inside the sheath. It is not coming out of the sheath. Okay, and this extension is up to the base of the skull unless and until it is entering the cranial cavity. Those students who are writing something else, okay, from all those things, don't be too smart. I know who is attentive in the class and who is writing or completing the practicals or completing other assignments. Okay, by looking at your face, I can recognize, I can identify. Okay, so every day coming to the class and repeating the same thing, I don't feel like doing that. Better you change yourself, or please don't come to the class. Coming to the class for getting attendance, that should not be the motto. Okay, I have seen few students coming inside the classroom only to get the attendance. If it is like this, don't come inside the classroom. Every time it is distracting. Someone will be explaining something and you will be writing. Last week, I think your parents came. At that time, we have discussed all those things. Okay, please be serious. If you don't want, you can leave the classroom. I don't mind. But don't do all those nonsense things inside the classroom. Now, inside the carotid sheath, I have shown you the contents. Next, on the anterior wall of the carotid sheath and on the posterior wall of the carotid sheath, some important structures are present. Now, in this cut section of the carotid sheath, this is the anterior aspect and this is the posterior aspect. On the anterior aspect, you can see Ansa Cervicalis is there. In the last class, several times I have mentioned about the Ansa Cervicalis. Do you remember? No. I know you don't remember because you have not studied, you have not revised. Okay. On the anterior aspect, on the anterior wall of the carotid sheath, Ansa Cervicalis is there, and on the posterior aspect, you can see the sympathetic chain is present. Okay. Now, what exactly is that Ansa Cervicalis? How it is formed? what are the roots of Ansa cervicalis, okay, that we'll be discussing. Now if you have seen the contents of carotid sheath, okay, among them the external carotid artery we have discussed, then common carotid artery also we have discussed, internal jugular vein we have discussed. Vagus nerve I have not started because we'll be discussing in the cranial nerve chapter. Okay, just I have mentioned that in this place this is the vagus nerve situated. Till now I have not started with any of the cranial nerve. Now you have noticed one thing, I have not mentioned anything about internal carotid artery. Okay, I have not mentioned anything about the internal carotid artery. Why? There is also a reason, because internal carotid artery is not giving any branch in the neck. There are various parts of the internal carotid artery, okay, they are called as segments. Total 7 segments are there. Now in those seven segments, the cervical part mainly, which is present in the neck, okay, from there no branches are coming out. Though we are studying the neck, and though there are no significant branches of the internal carotid artery in the neck, that's why I have not explained it. Once I'll start with the blood supply of the brain, okay, mainly the circle of Willis, at that time we'll discuss in detail about the internal carotid artery with its segments. Okay, a question that why I have not explained about the internal carotid artery, so this is the justification behind it. Now let's see about the Ansa cervicalis. So what exactly is this Ansa cervicalis? It is a thin loop of nerve, okay, embedded in the anterior wall of the carotid sheath, okay, over the lower part of the pharynx. And what is the function? It supplies the infrahyoid muscles. Can anyone know how many infrahyoid muscles are there? Total 4 infrahyoid muscles are there. Okay, that day I have shown you the chart. Origin, insertion, nerve supply, action, everything are discussed. Okay. Now to supply the infrahyoid muscle, this Ansa cervicalis is responsible. Okay. Now how the Ansa cervicalis is formed? It is formed by 2 loops. Okay, or you can say 2 roots, not loop. 2 roots are there: superior root and inferior root. So from where the superior root is coming? See, the superior root is the continuation of the descending branch of the hypoglossal nerve. Hypoglossal is the 12th cranial nerve. It is the continuation of the descending branch of hypoglossal nerve. Okay. Now the fibers are derived from, for this superior root, the fibers are derived from the first cervical nerve. So once the fibers are coming out from the first cervical nerve, it will descend over the internal carotid artery and the common carotid artery. Next, we are getting the inferior root. Now, inferior root is formed by ventral rami of C2 and C3. Okay, ventral rami of C2, C3. I hope you understand what is ventral rami, what is C2, C3. Okay, of the spinal nerve. Now, this root will descend and it will wind in front of the internal jugular vein and continues anterior inferiorly, okay, to join the superior root in front of the common carotid artery. Why? Sit down. So inferior root, as I said, it is formed by the ventral rami of C2, C3. Once it is formed, okay, it will descend and then it will wind around in front of the internal jugular vein. Then it continues anterior inferiorly to join the superior root in front of the common carotid artery. Okay, so the superior root is coming, inferior root will wind like this and then it will join the superior root. So like this the loop is formed. That's why it is called as Ansa cervicalis. Now here you can see the diagram. Okay. Now in this diagram you can see the superior root, descending branch of a hypoglossal nerve, which is carrying the fibers from C1. Okay, I hope you can see the diagram. Okay, superior root is also descending. Next, the inferior root, how it is formed? Please concentrate in the diagram. See C2 and C3, ventral rami of C2 and C3. See, it is descending and is winding in front of the internal jugular vein. Then it is going anterior inferiorly, okay, and then it is joining with the superior root. Okay, so like this a loop of nerve is formed. That is called the Ansa cervicalis, and this formation is taking place anterior aspect, on the anterior aspect of the carotid sheath. ठीक है, तो जो carotid sheath होता है, so suppose this is the carotid sheath, on the anterior aspect of the carotid sheath this loop is formed. Okay, that's why Ansa Cervicalis is the anterior relation to the carotid sheath. Okay, now what is the function? जो Ansa Cervicalis होता है उसका function क्या? What is the function of the Ansa Cervicalis? It supplies the infrahyoid muscles. Okay, as you can see, the branches supplying the different infrahyoid muscles. So superior root give branches to the superior belly of omohyoid. Okay, dependent loop give branches to the sternohyoid, sternothyroid, and inferior belly of omohyoid. Okay, so like this, as I said, these are supplying the infrahyoid muscles. Okay, so that is all about the gross structure of neck. Next, I will start with the applied anatomy of the neck. Yeah. Mainly the applied anatomy of anterior triangle. Okay. Anyone have you heard about the torticollis? Have you heard about the torticollis? I hope you have heard, you have studied also. Okay. So क्या होता है? What exactly happens in case of torticollis? So it is the deformity in which head is bent to one side and the chin is pointed to the other side. Okay, head will bend on one side and the chin will be pointed to the other side. This is the condition. This is called torticollis. Okay. Now, why the torticollis occurs? It mainly occurs due to the spasm in the muscle which are supplied by spinal accessory nerve. Spinal accessory nerve is also called as the 11th cranial nerve. Okay, so mainly two muscles are there. That is sternocleidomastoid muscle and trapezius muscle. Okay, as you can see, spasm or contracture of the muscle supplied by spinal accessory nerve, that is sternocleidomastoid and trapezius. Now, different types of torticollis are there. Rheumatic torticollis due to the cold and drought. Reflex torticollis due to the inflamed or sprouting cervical lymph nodes, which will irritate the spinal accessory nerve. Another one is congenital torticollis, okay, due to birth injury. Congenital means due to birth injury. Okay, whenever the parturition is taking place, at that time, when the fetus is taken out, if force is applied, okay, at that time what will happen? There may be damage to the muscle fibers of sternocleidomastoid muscle. That may also lead to the torticollis. Okay, and that is referred to as congenital torticollis. So here you can see the congenital torticollis is a contraction or shortening of the cervical muscles that produces twisting of the neck and slanting of the head, as you can see in the diagram. Now the most common type of torticollis is resulting from a fibrous tissue tumor, also called as fibromatosis coli. Okay, after that what will happen? It develops in sternocleidomastoid before or shortly after birth. Okay, that's why it is referred to as congenital torticollis. Now in this, what happens? The sternocleidomastoid muscle is injured when an infant head is pulled too much during the time of normal delivery, normal parturition. When the head is pulled too much, at that time what will happen? As I said, there will be a tearing of the muscle fibers of the sternocleidomastoid, and that is also called as muscular torticollis. Next, if there is a formation of hematoma, okay, that may develop into fibrotic mass. The hematoma may develop into fibrotic mass that will entrap the branches of the spinal accessory nerve, and that will denervate the sternocleidomastoid muscle. That can also cause the congenital torticollis. Okay. Next, spasmodic torticollis. So spasmodic torticollis is mainly seen in case of adult. Okay. When the spasmodic torticollis takes place, there will be bilateral combination of lateral leg muscle, especially trapezius as well as the sternocleidomastoid. Now, what are the disorders? Disorders will be on the turning of the head, tilting, flexing, or extending of the neck. This will be the disorders when a person is suffering from spasmodic torticollis, and spasmodic torticollis occurs in adult. Now, shifting of the head laterally or anteriorly can occur involuntarily in the spasmodic torticollis. Okay. So these are the different types of torticollis. Next applied importance, this is the subclavian vein puncture. This is a very important aspect of the applied anatomy of anterior triangle of the neck. Okay, I hope you have heard about central line placement or central venous catheterization. Okay, these are some important procedure in which, okay, this is an important procedure in which IV fluids are given for a longer period of time, different medications are given, then pressure in the venous system can be measured. Okay, so like these different procedures can be performed by puncturing the subclavian vein. Okay, now while doing that, a special type of catheter is used. It is called a Swan-Ganz catheter. Okay, now this catheter is also used during cardiac catheterization. Okay, right cardiac catheterization, left cardiac catheterization. Mainly during the right cardiac catheterization, this type of catheters are used. Okay, now we will not go into the Swan-Ganz catheter. We have to understand the surface landmark for subclavian vein. Okay, unless and until you know the surface landmark for subclavian vein, you will not be able to inject, will not be able to puncture the subclavian vein. Okay, now central line is inserted to administer venous nutritional fluid, medication, central venous pressure, etc. Now it is a infraclavicular subclavian vein approach. So what is the meaning of infraclavicular subclavian vein approach? That means the approach is below the clavicle. So for that, what you have to do, first of all, you have to place the thumb of one hand on the middle part of the clavicle. So where is the middle part of the clavicle? So you have to place the thumb on the middle part of the clavicle. Okay, and you have to place the index finger where? In the jugular notch of the manubrium. One hand middle part of the clavicle and index finger on the jugular notch of the manubrium. Okay, next what you have to do, you have to take the needle and puncture the skin inferior to the thumb. Where the thumb is placed, below that you have to puncture the skin. Okay, now when the skin is punctured, at that time the tip of the needle should be towards the index finger, not straight towards the index finger, until the tip enters the venous angle, that is the posterior to the sternoclavicular joint. Okay, this is how the needle is inserted. Here the internal jugular vein and the subclavian vein will merge together to form the brachiocephalic vein. Now let me show you the diagram. So here you can see the subclavian vein puncture. Okay. Now in the subclavian vein puncture, can you see the thumb? Everyone please focus in the diagram. I hope you can see the thumb. So one the thumb you will place on the middle of the clavicle and index finger in the jugular notch. Okay, and then where the needle is inserted, the skin below the thumb, and what is the direction? Towards the index finger, as you can see in the diagram. Okay, this is how the needle is inserted into the subclavian vein. Okay, but so this is the surface landmark, but nowadays any needle inserted into any of the vessel, ultrasound guidance is taken. This is blind technique. If you know the surface landmark and then if you are inserting the needle, that is blind technique. Okay, nowadays in order to prevent further risk, blind techniques are avoided because ultrasound guidance are available almost everywhere. Okay, so with the help of ultrasound guidance, the vein is identified and then the needle is inserted easily. Okay. Next, if the needle is not inserted carefully, then what can happen? Any idea? Suppose you are using blind technique, you are not using ultrasound guidance, okay, and then you are inserting the needle. If the needle is not inserted properly, then what can happen? क्या हो सकता है with the patient? Where the needle will go first? Any idea? It will go and it will puncture the pleura. Okay, and if you push the needle further, it can puncture the lung also. As a result, there will be pneumothorax. Okay, next it can also puncture the subclavian artery. Okay, so if the needle is inserted too far posteriorly, if you go too far posteriorly, then it can puncture the subclavian artery also. At that time there will be severe bleeding. Okay, that's why care has to be taken while inserting the needle. Once the needle is inserted in the place, it is connected with the catheter for guidance, and with the help of the catheter we can inject whatever is necessary during that situation. Okay, and for that already I have mentioned a special type of catheter is used, that is called Swan-Ganz catheter. Once you go for the posting, okay, at that time you'll come to know about all those things, catheters and all. Okay, next is the right heart catheterization, very important procedure, interventional procedure. Okay, so in order to do the right heart catheterization, okay, now see two types of heart catheterization are there, right heart catheterization and left heart catheterization. Right heart catheterization is mainly done for the right chambers, it is right atrium and right ventricle. Okay, for that we have to select a venous route. In order to do the right heart catheterization, we have to select a venous route. For that, internal jugular vein is taken, subclavian vein is used, okay, brachial veins are also used. So these are the different venous route which are used for right heart catheterization or right cardiac catheterization. Okay, so with the help of that, pressure of the right atrium, pressure of the right ventricle, then pressure in the pulmonary artery, all those things can be measured. Okay, so in case of right heart catheterization, okay, the puncture of the internal jugular vein is done. Okay, it is the preferable choice because the course of the internal jugular vein is very short. That's why the length of the catheter is also, which is selected, is also less. Okay, depending on the vein which we are puncturing, the length of the catheter is selected. Okay, now see, internal jugular vein can be used to introduce a catheter through the right brachiocephalic vein, and from right brachiocephalic vein to superior vena cava, and then it will go into the right side of the heart. Okay, now the question is, what do you think where the needle has to be inserted? In case of right cardiac catheterization, as I said, if we are selecting the internal jugular vein, okay, if we are selecting the internal jugular vein, at that time where the needle has to be inserted, means which particular area will be selected. Do you remember last class I have told you about the sternocleidomastoid muscle? If you see the origin of the sternocleidomastoid muscle, two heads are there of the sternocleidomastoid muscle. One is clavicular head and another one is sternal head. In between the two head, there is a small triangular space that is called as lesser supraclavicular fossa or lesser supraclavicular triangle, whatever it is said. Okay. So what is the content? What is present over here? In that there is the termination of internal jugular vein. Okay. So that particular area is selected in order to insert the needle for right cardiac catheterization. Okay. So here you can see the internal jugular vein puncture. Needle catheter may be inserted in the internal jugular vein for diagnostic as well as therapeutic purposes. Okay. So the right internal jugular vein is preferable. Why? Because it is larger and straighter. During this procedure, first of all, the common carotid artery is palpated. From the common carotid artery, you have to go laterally, okay, and you have to make a 30-degree angle aiming at the apex of the triangle between the sternal head and the clavicular head of the sternocleidomastoid muscle, okay, into the lesser supraclavicular fossa. Okay, so first you have to palpate the external carotid artery, the common carotid artery. From common carotid artery you have to go laterally, and then when the needle is inserted, slight 30-degree angulation is given, okay, aiming the apex of the triangle. So here you can see the diagram. In this diagram you can see where the needle is inserted in between the two heads of the sternocleidomastoid muscle. Okay, that also needle is inserted with 30-degree angulation towards the apex. Okay, so this is very important procedure. Okay, this is done mainly for right heart catheterization or right cardiac catheterization. Next, the external jugular vein, okay, near its termination, okay, it pierces the investing layer of deep cervical fascia and it gets adhered to that deep cervical fascia. So, if there is any damage or cut to the external jugular vein, okay, air is sucked inside the vein due to negative interthoracic pressure that causes air embolism. Okay. Next, pulsation of the subclavian artery. Okay, so subclavian artery can be palpated at the root of the neck by pressing behind the clavicle at the posterior border of the sternocleidomastoid muscle. Okay, now this is very important because if we press that particular area, if there is any hemorrhage or if there is any leakage of the blood in the upper limb, that can be stopped by compressing the subclavian artery. Okay, that will stop the blood flowing into the upper limb. I hope you have studied about the axillary artery. Next, another important aspect is the dysphagia lusoria. Anyone have you heard about this dysphagia lusoria? Dysphagia का मतलब क्या है? Difficulty in swallowing. Okay, so what happens in case of dysphagia lusoria? It is an unusual condition, okay, where there will be difficulty in swallowing due to the compression of the esophagus. Now here, why the compression is taking place? Because aberrant right subclavian artery. Okay, because of the aberrant right subclavian artery, and it is taking place on the right side only. Now, what is the meaning of aberrant right subclavian artery? It is a congenital anomaly where right subclavian artery arises from the arch of the aorta instead of the brachiocephalic trunk. Okay, mainly due to the anomalies in the brachial arches. That's why this anomaly is taking place. As a result, it will compress the esophagus, and then there will be difficulty in swallowing. That is called as dysphagia lusoria. Here you can see the diagram. So see, this is the lusorian artery. So what is this? This is the arch of aorta. Okay, now here you can see this is the esophagus. So the right subclavian artery is arising from here, from the arch of aorta. Okay, and it is, when it is going on the right side, it is compressing the esophagus. As a result, dysphagia occurs, and this is a congenital anomaly. Okay, next, carotid occlusion. Now, atherosclerotic thickening, when it is taking place in the wall of the carotid artery, at that time the carotid occlusion takes place, which can obstruct the blood flow. Now, symptoms which occurs during the obstruction, okay, is depending on the level of obstruction and depending on the collateral circulation. Okay. Now, partial obstruction, if it is taking place in the internal carotid artery, okay, it causes transient ischemic attack. Okay, at that time there will be sudden focal loss of the neurological function. Patient may suffer from dizziness, disorientation, and it disappears within 24 hours. So the carotid artery which is there, okay, especially I am talking about the internal carotid artery. So atherosclerotic thickening may take place, which will reduce the size of the lumen. Okay, as a result, partial obstruction may take place. Though internal carotid artery is supplying blood to the brain, at that time neurological condition may be there. Okay, now the amount of blockage which is taking place, and depending on the collateral circulation, the symptoms will appear. Okay, why I am talking about collateral circulation? If the blockage is taking place or partial obstruction is taking place in one side, blood from the other side will go and supply that particular area. Okay, collateral circulations are available. Now, there is a famous procedure, I hope you have heard, that is called carotid angiogram or carotid angiography. Okay, so with the help of the carotid angiography, the carotid arteries, the branches of the carotid artery, and the blood vessels which are supplying the brain, that can also be seen. So with the help of CT scan, with the help of MRI, easily the carotid angiography can be done. Okay, and even we can reconstruct 3D images also with the help of carotid angiogram, so that if there is any blockage in any of the branches, that can be diagnosed easily. Okay. Next, carotid pulse also called as neck pulse, that already you have studied, okay, how to feel the carotid pulse, and that is very important. When the CPR is given, at that time the carotid pulse has to be felt. Okay, it is routinely checked when CPR is given. Now, if there is absence of the carotid pulse, what does it indicates? Carotid pulse अगर absent है, if a person is not having carotid pulse, what does it indicates? It indicates cardiac arrest. Okay, carotid pulse अगर नहीं है in a person, whenever you are giving CPR, at that time when the carotid pulse has to be felt, अगर carotid pulse नहीं मिल रहा है, इसका मतलब क्या है? Patient is having cardiac arrest. Okay, that's why feeling the carotid pulse is very important. Next, there may be lesion of the, so we have discussed about the blood vessels, okay, various blood vessels. Now there may be lesions in the spinal accessory nerve also, okay. Spinal accessory nerve is also called as the 11th cranial nerve. Now generally damage to the spinal accessory nerve in the neck is very uncommon, but there may be injury to the spinal accessory nerve, okay. Now for example, penetrating trauma such as stabbing or bullet wound in the side of the neck, then surgical procedure when it is done, at that time there will be damage to the spinal accessory nerve, tumors at the base of the cavernous base of the skull, fracture of the jugular foramen. Okay, so these are the reason by which the spinal accessory nerve can get damaged. Now what do you think, what will happen if the spinal accessory nerve is damaged? The spinal accessory nerve is supplying two important muscles of the neck, that is sternocleidomastoid muscle and trapezius muscle. Okay, so what will happen? There will be contraction of the sternocleidomastoid muscle, turns the head on the one side. Now if the lesion is unilaterally, does not produce an abnormal position of the head. Now in case of 11th cranial nerve injury, there will be weakness in the turning the head to the opposite side. Okay, now if you are turning the head on the opposite side, there will be weakness against the resistance. Suppose someone is applying resistance and you are turning the head, then the person will feel very weak. That indicates that there may be damage to the spinal accessory nerve. Lesion of the spinal accessory nerve produce weakness and atrophy of the trapezius muscle, impairing the neck movement. Okay, now paralysis will also be there in the trapezius muscle. Okay, at that time patient will be unable to elevate the shoulder. Okay, as you know, in which trapezius helps. Then normal prominence of the neck produced by the trapezius is also reduced. Dropping of the shoulder is obvious when there is injury to the spinal accessory nerve. So these are some symptoms which can be seen in the patient when there will be injury to the spinal accessory nerve. Okay. Now, do you remember the nerve point which I have mentioned in the neck? Okay. So the nerve point is very important because so many nerves are coming out from that particular point, and as I said, we'll be discussing a very important applied aspect. Now for regional anesthesia, before the surgery, cervical plexus block is used. For that, anesthetic agent is injected at several points, not one point, at several points along the posterior border of the sternocleidomastoid, especially at the junction of superior and middle third. Now that particular part is also called as the nerve point. तो जो sternocleidomastoid muscle है, उसका जो posterior border है, posterior border का superior third and middle third, that particular area is also called as nerve point. Okay, so in that particular area the anesthetic agents are introduced, okay, before doing any surgery in that particular area. Now there is a contraindication if any person is suffering from pulmonary or cardiac disease. At that time that procedure is not done. Why? Because whenever we are injecting the anesthetic agent, it can anesthetize the phrenic nerve also, and we know that phrenic nerve is supplying the diaphragm. So if a person is having pulmonary and cardiac disease, at that time this particular procedure is not done. Next, for the anesthesia, any surgery which is done for the upper limb, okay, fascia for the upper limb, the agent in the supraclavicular brachial plexus is introduced around the supraclavicular part of the brachial plexus. Okay, that is the superior point to the superior part of the midpoint of the clavicle. So these are some important areas where anesthetic agents are introduced before doing surgeries. Okay, if you remember the diagram, last week I have shown you the nerve point. Okay, while explaining about the sternocleidomastoid muscle, the important relations of the sternocleidomastoid muscle. At that time I have mentioned the nerve point. Okay, and here you can see the anesthetic agents injected in the nerve point before doing various types of surgeries. Okay. Okay. Next is the ligation of the external carotid artery. Okay. So what do you think, why the ligation of the external carotid artery is required? To control the bleeding. Okay. Now this is not very effective. Why? Because of the collateral circulation. It will decrease the blood flow, but due to the collateral circulation, this particular procedure is not effective. So ligation of the external carotid artery is sometimes necessary to control bleeding from one side, okay, relatively inaccessible branches. So there are some branches which are not accessible directly. So for that, what we do, we will compress the external carotid artery. Now this procedure will decrease the blood flow, okay, but will not eliminate it. Why it will not eliminate? Because we know that external carotid arteries are present on both the sides, okay, and in between the external carotid artery, the branches, the anastomosis are taking place. Okay. Now, for example, external carotid artery on the either side communicates between the branches on the face and scalp across the midline. Okay. So, what you have to do, you have to compress on the both side in order to reduce the bleeding, in order to stop the bleeding. Okay. Now another important anomaly which is seen in the floor of the mouth, okay, that is the ludic angina, and it is life threatening condition. Anyone have you heard about the ludic angina? This is a very important serious life threatening condition. Now, क्या होता है? What exactly happens in case of this ludic angina? So it is a cellulitis of the soft tissue involving the floor of the mouth, okay, and the neck. Generally it occurs due to the infection, okay, from the second third molar tooth. From there infection can spread into the floor of the mouth, okay, and from there the cellulitis occurs, and in 90% of the cases the cellulitis occurs from the infection of the second and third molar tooth. Okay. Now what happens? It rapidly progresses to the surrounding tissue, leading to potential lethal complications. Now what are those lethal complications? Obstruction of the airway, aspiration pneumonia, carotid arterial rupture, and sheath abscess. These are the complications taking place. Though there may be chances of airway obstruction, that's why it is very lethal. Okay, because once the cellulitis is formed, gradually it will grow in size. Okay, and in the initial stage you will see that there will be replacement, or you can see there is elevation of the mylohyoid muscle, because mylohyoid muscle is present in the floor of the mouth. Okay, so that is the ludic angina. Now here you can see the condition, the swelling in case of ludic angina. This is the initial stage. Okay, so from the infection of the second and third molar tooth, it spread into the floor of the mouth. As a result, cellulitis occurs. Gradually, it will grow if it is untreated. Okay, if the size increases, what will happen? It will obstruct the airway. It can compress, and there may be damage to the carotid arteries also, which is life-threatening. Okay, and when it starts gradually, when it enlarges at that time, abscess will also be there. Okay, so here you can see. Now when the cellulitis is forming, at that time you will see the mylohyoid muscle is elevated. Okay, that is the initial stage, and the treatment should be done at that particular stage only, or else it is life threatening. It is the duodenal angina. Okay. So lastly, see, there are so many applied importance of the anterior triangle of the neck. Okay, so as I said, I have selected few. Okay, others whatever it is left, please study from your own. So lastly, I want to show you one diagram. Okay. Okay, now here you can see a diagram. Now, can you guess which diagram is this? Can you guess which diagram is this? Yeah, can you see the arch of aorta? Okay, so just now I have mentioned about the internal carotid artery occlusion. Okay, now this is the diagram of, or you can say this is the 3D image of carotid angiogram. 3D image of carotid angiogram. Okay, now here you can see the arch of aorta, starting from the arch of aorta. Then you can see the origin of common carotid arteries. Can you see the common carotid arteries? Yes. After that, I hope you can see the bifurcation of the common carotid artery, and then you can see the internal carotid artery, and you can see the external carotid artery also. Okay. Next, the course of the internal carotid artery entering into the cranial cavity, forming the circle of Willis and the cerebral arteries. Everything can be seen in a particular diagram. Okay, so this is a 3D diagram. Why I am showing you this is a normal diagram, normal 3D representation of the carotid angiogram. Okay, so carotid angiogram is done mainly to see the blood vessels which are supplying the brain. Okay, details I am not going now. When we'll discuss the blood supply of the brain, at that time few things will be discussed, because this is very important. Suppose if cerebral stroke is there, cerebral hematoma is there, different types of cerebral hematoma are there, at that time this particular imaging modalities are very helpful. Okay, CT scan also, MRI also. Mostly during the time of acute case of hematoma, CT scan is done, because in MRI time taken is more. Okay, so with the help of the CT scan, 3D representation of that particular area can be achieved. Now here you can see only the arteries and the branches are seen. Okay, other parts are not there. Okay, so this is a capability of the software, that it can remove all the other structures which are associated with it, so that you can see only the blood vessels and the branches. Easy for the radiologist to diagnose, to do the diagnosis. Okay, so this is a beautiful 3D image of a carotid angiogram. Okay, showing almost all the branches. Okay, so that's all about the applied anatomy of the anterior triangles of the neck. Okay, few topics will be left, so I will request everyone, whatever it is left, please go through it. After that, if there is any doubt, you can ask. Okay, okay, thank you.